Hello, my name is Ritika, and I did my internship at Kaiser Permanente. Throughout my internship, I got to talk to many different types of individuals in the healthcare industry. I got to talk to doctors, nurses, and even some receptionists. But one statement that really stood out to me was said by Dr. Adams in Family Adult Medicine, and he described medicine as like gardening. Because after you're done with all of your schooling, your first year as a doctor is pretty rough, as you're still establishing connections with all of your patients. So many of your seeds in your metaphorical garden will not begin to sprout. But after a couple more years, your seeds will begin to grow into small plants, and then after a couple more years, all of your plants will be grown in your garden, and you may even see some fruits and vegetables in your garden if you're lucky. Now, what I learned from this story is that you will not achieve your end goal immediately. It will take a lot of hard work and time to get there, so you might as well enjoy the journey while you're on your end goal. This concept was repeated many times during my internship, as many doctors always asked why I wanted to go to medical school. They were curious to know whether medicine actually fascinated me or if I was just influenced by others around me. But when I explained my interest in human anatomy as well as my fascination with the interactions between patients and medical specialists, they told me to always remember why I chose medicine in the first place. Not for the end goal of being a doctor, but rather for my interest in uncovering the mysteries of the human body, a machine that builds itself. This was true as, in fact, becoming a doctor takes several years of training. There's first 4 years to get your bachelor's degree, then 4 years of medical school, and then 3 to 8 years of residency depending on your specialty. Now, for example, to be a general pediatrician who's in primary care, it takes about 3 years, and then for general surgery, it can take up to 5 to 7 years. If you don't enjoy this journey of being a doctor, it is a pretty long journey. You will not acquire the skills you need or establish any relationships along the way. In the emergency department, I learned about the concept of enjoying the journey again when I shadowed a nurse named Lisa. She explained that one of the best aspects of being a nurse is establishing connections and relationships with your patients. Now, many other people in the healthcare industry do not get to experience this. And now in the ER, she only has about 4 patients at a time, so she is able to have these communications with her patients. She showed me an essay that she wrote about what nursing meant to her. And in this essay, she describes a male patient who is diagnosed with stage 4 lung cancer at the age of 45. His cancer had already spread to distant parts of his body, including his brain, his bones, and his liver. And it was expected that he'd only have about a few more weeks to live. And his pain was almost intolerable because his cancer had spread to most of his body. His wife wanted him to continue fighting and have repetitive surgeries, but she was blinded by the fact that she was about to lose her loved one to realize the risks of having these multiple surgeries. Lisa, the nurse, was able to talk to the patient's wife and share her own experience of losing her mother at the age of 14 to cervical cancer. She was able to establish a connection with her patient like no one else could. She even explained that every day was a part of her nursing journey, and every day she learned something new. And surprisingly, most of the things that she learned had nothing to do with medicine, but rather human connection. Another patient that I met that emphasized the importance of a journey was a patient that I met during my first day of physical therapy. She was a 56-year-old female who had been diagnosed with osteoarthritis at the age of 56, 10 years ago. Osteoarthritis is when the protective cartilage between your femur and your tibia has worn over time, as you can see in the picture. And this basically causes excruciating pain whenever you have any sort of movement. This joint disease isn't curable, but you can relieve some pain by doing some exercises and special treatments. She has been going to physical therapy with the physical therapist that I shadowed, whose name was Logan, for over 10 years. And the physical therapist explained that every time she came in with a smile, with this sort of positive attitude, because she knew what her end goal was and she was ready to work and complete her journey. The patient explained that she enjoyed physical therapy because it allowed her to relieve this pain, and she knew that if she enjoyed this journey on her way and worked hard, she would be able to reach her goal and do normal activities without having to worry about her disease. Even though her journey is difficult, she chooses to enjoy this journey because that is the real success. Now, throughout these different stories, there is a common concept that I learned about enjoying the journey rather than the end goal. There will always be roadblocks on the way towards your destination, but this journey is what allows you to achieve personal growth. If you're only looking at your end goal, you won't be able to appreciate your journey and appreciate the opportunities that you're given. Thank you.
Okay, so my name is Kumar Viswanathan. I